Hello, aspiring psychologists. Today we will begin our unit on personality disorders, starting with this whiteboard animation introduction, which will cover DSM-5 criteria, prevalence, and the 10 personality disorders found in the DSM. For those of you who don't know what the DSM is, it is the Diagnostic Statistical Manual of Mental Disorders, 5th edition, made by the American Psychiatric Association. This guide classifies every recognized mental disorder and provides standardized diagnostic criteria for each. The DSM defines personality disorders as a pattern of inner experience and behavior that deviates markedly from the expectations of an individual's culture in at least two of the following areas. 1. Cognition. 2. Affect. 3. Social. Or 4. Impulse control. In addition, personality disorders must be causing an individual significant levels of distress or impairment in their daily lives. This pattern of behavior must also be inflexible and pervasive across a broad range of situations. Moreover, a personality disorder must be stable and have early onset to meet the criteria for a diagnosis. But just how prevalent are these disorders? Well, in the overall population, it is estimated that 9 to 15% of people will meet the criteria for at least one personality disorder diagnosis. However, the chances of any given individual disorder occurring are much lower, ranging from 1 to 5%. So how is it that these numbers don't add up? The answer is comorbidity. Comorbidity is the simultaneous occurrence of two disorders in one patient. Furthermore, comorbidity among personality disorders is very high, likely due to similar traits underpinning multiple disorders. Now let's begin our review of the 10 personality disorders. The DSM breaks down personality disorders into 3 clusters. Cluster A, odd and eccentric. Cluster B, dramatic and erratic. And Cluster C, anxious and fearful. Before we begin, please note that the following descriptions are of typical presentations and symptoms can and do vary greatly among patients. Beginning with Cluster A, there is paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Paranoid personality disorder can be characterized by a pervasive distrust of others, holding grudges, suspiciousness, extreme jealousy, and a hostile world attribution bias, which entails taking ambiguous or neutral information and interpreting it in a negative or hostile way. Next, schizoid personality disorder commonly presents with antisocial behavior, detachment from social relationships, flat emotional expressions, the inability to experience significant pleasure, a preference for solitary activities, and an indifference to praise or criticism from others. Lastly, people with schizotypal personality disorder generally are considered very odd and eccentric. Commonly, they possess strange beliefs such as the belief that they can do magic, have unusual perceptions, display inappropriate affect, have extreme social anxiety, and often lack friends. Note that although this is sometimes considered subthreshold schizophrenia, it is not the same as schizophrenia. Now on to Cluster B disorders. There are 4 Cluster B disorders: antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Let's begin with antisocial personality disorder. People with this disorder are often highly aggressive, impulsive, irritable or angry, deceitful, and lacking in remorse. Interestingly, we should note that this disorder is especially prevalent in prisons and among convicts. Next, borderline personality disorder can essentially be defined by instability. This includes unstable emotions, unstable relationships, and unstable identity. Further, people with borderline personality disorder often demonstrate impulsive behavior, possess feelings of emptiness, engage in attention-seeking behavior, and display inappropriate anger. Histrionic personality disorder is typically defined by an extreme need for attention, attention-seeking behavior, excessive emotionality, dramatic and theatrical actions, extroversion, and the need to be the center of attention. Lastly, narcissistic personality disorder is characterized by grandiosity, a need for excessive admiration, a lack of empathy, a sense of entitlement, exploitation of others, and preoccupation with oneself. Now into Cluster C. There are 3 Cluster C disorders: avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. To start, avoidant personality disorder typically presents as social avoidance, introversion, extreme fear of socializing, feelings of social inadequacy, and loneliness. On the other hand, someone with dependent personality disorder may demonstrate a strong need to be cared for, clingy and submissive behavior, a lack of self-confidence, a sense of helplessness, and the need for constant advice or reassurance from others. Our final personality disorder, obsessive-compulsive personality disorder, is characterized by perfectionism and excessive concern for order and control, preoccupation with the rules, rigidity and stubbornness, and devotion to one's work. Note that this is not to be confused with obsessive-compulsive disorder, as someone with obsessive-compulsive personality disorder does not possess specific obsessions or compulsion, but rather an overall need for order and control. Now that we have gone over the basics of personality disorders, you should feel ready to begin our unit. Keep in mind what you have learned in this animation as you approach any new material, and feel free to rewatch it if you need any clarification or wish to review. Good luck.